Hello and welcome everyone. It's my pleasure to introduce Professor and Dr. Prantar Chakrabarti, a distinguished hematologist, academic leader and healthcare innovator. Formerly the Head of Hematology at NRS Medical College, Kolkata. He is now working with Zoho Corporation to develop an accessible and affordable rural healthcare model. He is also the founder of Cybernetic Care and a visiting professor at Sri University, Cuttack. So please join me in welcoming Professor and Dr. Prantar Chakrabarti. Hello, Doctor.
Hello.
What inspired you to become a doctor and specifically to specialize in hematology?
It's a long story. So during my school days, it was all about debating, extempo speeches and everything. I saw people, we even had career counseling sessions in our school. But my primary motive in becoming a doctor was something which was totally different as to what we learned there. And that was to remain independent. Because I somehow thought that people in other professions, they were becoming either slaves to the industry or to the corporations. And here was one profession where, if required, I can be alone and do what I love to do. So that was one, but obviously, it incorporated learning biology, mathematics and physics. And I remember my first day at the medical college, they asked me, what is your favorite subject? I said, it's physics. So then they said, then why have you come into medical science? So I said, if you look at it, and now obviously 35 years down the line, I've realized that these are all silos we make ourselves. Actually, there's no division. Ultimately, you have to touch human lives. Now, you can be a doctor, an engineer, or anything. So that was the main motivation in becoming a doctor. And as I entered the wards, the first 2 years, it's horrible. You have to memorize a lot of things. You don't remember most of the things. And exams are there almost every day. So I thought, okay, where have I landed? But anyway, then from the third year, when we enter the wards, when we interact with patients, and it's more of a clinical apprenticeship, I started enjoying it. So in medical science, the first basic degree in India is MBBS. It's a bachelor's degree. Then comes the question of specialization. So till I started my internship, I thought I would like to become a surgeon. I'll maybe repair something, cut something, join something. During my internship, I realized that I was more interested in getting patients ready for the surgery rather than doing the procedure itself. So then I said, okay, I'll now go into medicine. And actually, medicine is the mother of all the disciplines, and we label ourselves as internists. Okay, so who are the externists? Skin and other people. So that is how I specialized in medicine. After I specialized in medicine, during that time, I did a dissertation on a particular problem of the liver. So I thought, okay, now let me go into gastroenterology, which deals with the liver and its diseases. Then what happened at that time is, I meanwhile joined as a medical teacher in an institution where there was a department of hematology. Let me tell you, hematologists till to date are an endangered species. Okay, you don't find many of them. Slowly we are increasing our diatribe, and then I realized that this is one branch where whatever happens in the laboratory can be translated to the bedside within a few days. And the other thing was again that independence, that when you see a patient, you're also trained to look at the blood smear of that patient. So you don't depend on others. So I think the essential thing about medicine, hematology has been whether I can remain independent, especially in a country where you cannot get all resources and you cannot afford the luxury of becoming a specialist.
Thank you so much, Doctor, for sharing your story. So in your role as a healthcare provider, administrator, or a teacher, what is the most fulfilling, I can say, a career that is there, and how do they feed into each other?
Let me tell you, as I was already explaining, that you cannot afford to wear a single hat in whatever you do in our country. So we wear at least 10 different hats. One of is obviously is the service provider, healthcare provider. One of is a teacher, researcher, administrator. And then you also have to be a fund generator. You have to be an advocate for your patients, for your specialty. And you also have to integrate everything for basic community awareness. I think the most fulfilling part of it is definitely mentoring, which includes teaching and research, because when you are providing service and you are seeing a patient, diagnosing, when you look at the smile at the end, when the journey is complete, sometimes you can't do well. It is a single one-to-one. But when you start mentoring others and you see that they are going out, and then you get a call, okay, I met one of your students and he was so good, he was so kind. You feel so fulfilling that yes, at least you have done something that at the end of the day you can say that you have done it. But the problem remains is that as you try to do all these things, you should not forget your ikigai. Nowadays, most of the young people, first day they come into residency and they talk about work-life balance, right? See, in our days, and I think it still remains the same, we did not know even what life was. When other people were enjoying, we were either studying books or seeing patients or spending most of the time in the hospital. When we talk of that balance, the problem is that balance means that one is going this way, the other is going this way. Work and life are not like that, at least in the medical discipline. You have to integrate them. So when you integrate them, you might have to go to the parliament to advocate things. You might have to go to patient support groups. You might have to go to the media, especially when you have epidemics and pandemics. And then you also have to look at life beyond healthcare. So there are so many facets to it. And frankly speaking, unless you can get in different directions, if you just remain a prescriber, you will not only get bored, you will get burnt out. Other than this, we always encourage our medical students even to have a hobby which has no relation possibly to all these hats which you told. But unless you take good care of yourself, you cannot wear these hats and you cannot do all these jobs. And especially in India, because there are people who do not have that kind of a voice. You have to be their voice. Now, if you have to be their voice, if you have to lead them together, we always remember what Professor Virchow said almost 200 years back. Medicine is social science, and medicine at a larger level is politics. Okay. Now, politics is a much hated word, but I think what he meant was that you have to be a community leader, a key opinion leader, so that you can dictate how a human life can be more mature and more fulfilling. So it's a smooth transition. I try to go into all those domains, but ultimately, as I told you, the thing I most enjoy is mentoring.
So moving on to the next question. So you have digital health in your website. So can you please tell me how it transformed the healthcare, how it transformed the patient care and the education?
This transition, which is quite different from hematology, happened during the COVID pandemic. So there was one technology university, the vice chancellor told me that we were planning to set up a center for digital health. And can you please then do some sensitization webinars? So I started reading about it. And then I realized that there are several facets to it. When you say digital, what do you mean? Do you mean it is digitized? Do you mean it is digitalized? So when I speak of digital health, it starts from not only, converting your analog things into digital 01, it comes from basic documentation which a machine can understand. So let me talk of our prescriptions, right? If you look at a doctor's prescription, most of the time they themselves can't read their own handwriting, right? So it is not human readable, it is not human understandable, and it is not machine readable and not machine understandable. So what can be the next step? The next step can be that, yes, it is in a form which humans can read, but it is not structured. We had that problem before natural language processing came. So it was machine readable, but it was not machine understandable. Now it has become machine readable, machine understandable. The next step in digital health is machine readable, machine understandable, and decision making by the machine to help me. So in all these facets, I think I always talk of the power distance. Now, what is a power distance? When a patient comes to me, they invariably always believe that they are inferior to me. I am sitting on a superior pedestal. I know everything, and whatever I say, they have to accept it. I think that is not the way healthcare should be there. It has been seen that Asiana Airlines planes have crashed because the co-pilot had detected a problem but did not communicate to the captain. So if I consider myself a captain and the patient as a co-pilot, if that power distance is not abolished, then the care cannot be a co-creation. And there lies the most important aspect of digital health. Because there's no hierarchy. They can take help of even their common apps, record something, record a voice, and they can get an extension of what we call a face-to-face interaction. So people criticize me saying, the most important is face-to-face, human touch. I do agree. But what happens to a person who has to travel, say, hundreds of kilometers, loses a day's livelihood to get this face-to-face interaction? So digital tools and digital health will transform it. And we have to remember that there are at least 1 billion people in the world who rarely get a chance to meet a healthcare service provider and get a solution. So it's all about technology bridging the gap and taking healthcare to the people so that there is equitable access. So whatever we do in terms of electronic medical records, health records, voice to text, ultimately they are supposed to improve the delivery, make it safe, and improve the quality.
So another question on the website side. I also saw on your website about a True Mentor Academy. So can you please explain me about it, because the name is so fascinating and I really wanted to know how are you going to plan ahead with this?
Right at this point of time, this year, we will be producing around 125,000 medical graduates, in our country. And the cabinet has already said that they are going to increase the seats by another 10,000. The problem is that you do not have that amount of quality faculty there. I believe 50% of the medical graduates who are coming out of our medical schools, they are not confident in treating their own parents. And they are lacking some skills which are not even taught at medical schools. They are being integrated into the curriculum, but there are so many things that they do not get priority. And those skills are like empathy, the breaking the bad news, listening to the other story carefully, patiently, and sometimes in spite of knowing that, we cannot cure, we should still try to heal that person. So True Mentor Academy, obviously it came from True Mantar, would be a learning management platform where this kind of skills, and it is not only for doctors, it is for nurses, paramedics, technicians, all who are in the healthcare ecosystem, where they have to understand that we are dealing with human life. So True Mentor Academy is basically an effort to bring back two things. One is health. Most of the systems today are only focused on disease, but we have to be healthy. So I have plans even of developing a course, how not to be a patient. So that is one. And the second is bringing care back to healthcare. And care can only come from a human. There can be technologies all around it. But how does the human talk to another human? And how does a human talk to a machine? That is the basic motto with which we will be doing it. And there is so many unmet needs. I am taking feedback on Twitter and other social media, and we will try to mentor these people, mostly probably online, but sometimes face to face.
I have one more question on the same line.
Yeah.
Where can we find this course actually?
Yeah, so this course will be found on the website, but I've been too lazy to develop it. If you go there, and incidentally, it is using a learning management platform called TrainerCentral, but the videos and all I'm still planning, and I can't do everything myself. So it has to be a stepwise manner. I think it will be available at chumentor.com in
Okay.
another 6 months.
So, in your upcoming seminar, so how do you plan to address the role of digital tools like AI and machine learning? And how are you going to improve the patient outcomes in the hospitality, basically in the hematology field?
Before entering in conversation with you, I saw on X one of my juniors who works with AI in radio diagnosis, and has shown that certain algorithms, certain large language models, they are not performing that well, but I know they will improve. And then I see, as it is always, people, they have their own opinions. They say, no, technology will solve all the problems. The thing you have to understand is that this is a human-centric domain. So, technology will help you. Now, suppose in hematology, what happens? A patient comes, usually they come by referral. There are some, who do some Googling or ChatGPT and then come directly. Most of them are referred by others. Each of them carry a Mahabharata, right? Because they would have visited at least 3 to 5 persons. They have all those reports and those prescriptions, and now they seek our opinion. Now, you have to imagine that a super specialist like me, we are more like the Supreme Court. There is no further platform where they can go after me. So, I always feel that, am I guilty of not looking at all those papers? Now, it is sometimes humanly impossible. That is where the capabilities of the current AI platforms in summarizing, highlighting. But then the problem remains is sometimes it has catastrophic forgetting, sometimes it hallucinates. So anyway, you can develop your own team, you can develop other members who have a basic knack. We call this a Gurukul thing. Medicine, if you read only books, I can confidently tell you will never be able to practice medicine, because it's more a thing which you learn by observing, right? You observe your guru, you do an apprenticeship and you learn it. Now here, if you think of how digital health will do, how AI will do, the first thing is the people who are going to use it, they should understand what it is. And moreover, I know I might be criticized on this point, they should take up on the leadership. So if you're developing an app using AI for, say, some hematology diagnosis or treatment, you sit in your technology lab, you do some mining, and you say, now I've developed the best. The doctors have to understand what AI is. I'm not asking them to learn coding, that is not required even, but they have to understand how it can help and what are the limitations. And most importantly, they know where the shoe hurts. So they should identify the problem which could be solved. So people continuously criticize me saying, you will become like robots. I say, no. My robot, my chatbot will do the summarization for me so that it gives me more time to speak to the human being. Can you tell me what is the average consultation time in India if you take right from a primary health center to a, say, tertiary care corporate hospital? Any idea?
I have no idea actually.
2 minutes. Okay? That is the average consultation time a patient gets. This has been published, right? So in 2 minutes, are you able to get even a grasp on what the patient is suffering from? And because of the power distance, as I told you, patient will forget to mention some of the important points. So here is how the tools will amplify my interaction. The tools will help me understand, and I can be more human. So that is why there's a book called, Deep Medicine. You become a partner in the patient's healthcare journey and you make it better. So what we have to do for the medical community per se is they should understand the ins and outs of the technology which is there. They should also validate it, right? It's not that someone says that we have developed a model, Palm 2, which has done very good in USMLE. USMLE or say in India, NEET PG. These are not the ideal ways to understand how you should practice medicine. So in the real world, unless you validate whatever tools are there, and unless you partner those developers, they know one side of the story, you know the other side. If you do not work together, like you do not have a, say, hacko-med, as I call it, a hackathon with medical people, then you will not be able to do justice to whatever you're trying to achieve in terms of better outcomes, safe outcomes.
Doctor, can you share me basically a story that is something that how it has supported you or the healthcare community?
Yeah, so I can share my own experience. There was a very senior government official who came to me. He had already consulted 2 hematologists and other physicians. He had a problem with blood clots. The total number of documents he had was 77, right? And then I always encourage patients to take pictures and send them beforehand so we can generate a summary or some kind of electronic medical record. So I used an LLM to generate a summary, which, in our parlance, we call it SOAP. SOAP means subjective, objective, assessment, plan. So I generated that note, and then just as I'm discussing with a friend, I said that as a professor of hematology, how do you think this patient should be managed? Okay. I have already taken the decision how to manage. The prescription is ready. Then it gave some of the evidence and it gave me a plan. It was a validation of whether I was right or wrong. So the story is that when you are practicing alone, when you're in a group, right? So in a teaching OPD, there will be 1 professor, 2 senior residents, some junior residents. You all discuss and do it. You don't have the luxury everywhere. When you're in a single doctor clinic, you get a complicated case who has come to you for the 3rd or 4th opinion. To summarize it, make sense of what has gone. And if it's a rare disease, you can always validate it using some sort of a model, and then you can take your decision. But now you have a friend. Before that, what do we used to do? We used to call a friend, like KBC, right? Call a friend or call my sir. We still do it, but at least we have another person who can be considered a friend, who is not judgmental, who is helping you in this journey.
Thank you so much, Doctor, for the story. Now, next question is, what are the current government initiatives in India that you believe are doing well in terms of rural healthcare?
The first thing what the government did, that was during COVID, was they made certain regulations which made teleconsultations legal, right? Before that, some people considered it to be illegal. There were a lot of litigation. So that was done in March 2020. Then what came were the digital health policies, right? So that was an important step. And then it has come through, you have the National Digital Health Mission. Now you have the Ayushman Bharat Digital Mission. Now, one important thing what they have done is, they have at least made people aware of what digital health is. By people, I mean both the receivers and the providers. The second important thing which has happened is telemedicine, which obviously was accelerated by the COVID pandemic, but you have e-Sanjeevani and similar, which have shown to benefit people at their point of care, where they don't have to travel, they don't have to stand in long queues. That is part of it. The next important step that has been taken by the government is looking at interoperability. Now, what is interoperability? right? In India, one of the best things we have, unlike certain developed countries, is the patient owns the medical records, right? So that is a very good thing. And the patient, if he or she wants, can share it with someone. But to share it, one machine does not talk to another. And how does the patient get access to it? So I think the framework for this interoperability, where government actually faltered, was they thought that people would do it on their own. That will never happen. Because if I am a corporate entity where I am making profits, I would not like my patient to go to some other facility. So that was some conflict of interest there. They are trying to take care of that also, so that a person, first of all, is mapping of your healthcare providers, your healthcare facilities, your diagnostic laboratories, your treatment functions. That is important. Second is, as I say, one India, one identity. That has not been done. I have myself applied 300 days back. I haven't got it, but it's a good initiative. It will happen. The third important thing they have done is that they have tried to rationalize the entire delivery through some sort of standards, not only digital standards of care, and then you have drugs, you have certain tools. So these are good initiatives. But unfortunately, here I will criticize the government. They might criticize me also, no problem, that they are only looking at numbers. They have to look at the quality, right? If I do a teleconsultation, I'm counted as one. But was it a fruitful one? Did it prevent me from going all the way and losing my livelihood? Unless I achieve that kind of, and what is the person's satisfaction? When I first introduced electronic medical e-prescriptions in my OPD, patients used to come and complain to me, ki sir, they were only looking at the monitor, they were not looking at me. Now, obviously, you have voice to text and all those things, and some sort of med scribes which are slowly coming in, they'll be better. But ultimately, we are doing it for a human. So whatever initiatives, be it the government sector, be it the private sector, whatever we do, it should be human-centric. And what we need to do more is not only when the citizen has a disease, what are we doing in terms of digital health tools to have them adopt a better lifestyle, right? So that they walk. I know in government offices, if you don't do some movements, sometimes your salary is also cut for a day. That is good. But how do you encourage the entire community to move? How do you use gamification so that they have healthy food, they have a healthy movement and a healthy lifestyle? A lot needs to be done. And I think, who is the government? That is also a question. Sometimes I asked a villager that who is the government? Said, the postman who brought me the government notification, that postman is the government. So we are all part of it. If we work together and we try to become a better human race, I think it will be done. There have been some initiatives, but it needs more.
Okay, thank you so much, Doctor. Moving on to the next question on the same lines. So what role do government versus central government play in improving the healthcare in a rural district like Tenkasi?
There was a headline about Tenkasi, I think about 10 days back, that these are the number of patients who are coming and this is the number of doctors. Huge gap. The distribution of doctors, urban versus rural, it will not happen. If you keep on increasing the number also, it doesn't guarantee that they will go to Tenkasi. So what can be done is, you have to have some sort of point of care which will do most of your assessment. Teleconsultation is not just a video chat. It's more than that. Good history taking is the first part. That can be facilitated by a local person speaking in the local language, in the local dialect. After that, in a non-invasive manner, you have to look at different organ functions, right? You look at the heart, you look at the kidney, you look at the lungs, you look at the liver. Because if you tell, no, I will do blood tests, then that person has to travel so much. And I think I went to Tenkasi Government Hospital. It has MRI, it has ultrasound, it has good quality digital x-rays, but there was only one radiologist reporting. It is not humanly possible. So here is how the digital health tools can come for screening. They can flag certain things so that when he's very busy, very tired also, he doesn't miss it. We always say that we try to make it safe and better. These two are our keywords. So I believe if you consider a district like Tenkasi, you have the machines, you build new buildings. Now there will be a medical college there. But what is the rate limiting step? It is human resources, skilled human resources, with the gap being breached by technology.
So how do you think Zoho for Healthcare will play a bigger role in this entire challenges?
You look at what Zoho has done till now, right? It has helped small and medium businesses. And if you look at the Indian scenario today, it is far easy to book a train ticket or a plane ticket than to book an appointment for a healthcare consultation. So the journey should be that the patient, first of all, would be empowered in trying to get an idea as to what to do, right? That is a basic awareness thing. Certain data are captured in terms of non-invasive monitoring through wearables, which are not locked again, that you have to buy a very expensive phone. No, basic things. Maybe the ASHA workers can have those wearables. Maternal and child health, capturing the data of the fetus and the mother. Then when the patient goes to a healthcare facility, first of all, as I say, I'll give you an example. Fetal heart monitoring. It is possible today to develop a technology so that the mother can be taught to keep a small device which is continuously monitoring the fetal heart. If there's a problem, immediately a signal goes to the cloud and an ambulance arrives and taken to the nearest healthcare facility. When they go to the nearest healthcare facility, by that time the basic data should be there. It should not be that when someone in distress has arrived, then you start taking it. So that's why in healthcare we talk about the exposome, right? So whatever we are exposed to, right from our birth till our death, those data should not remain in silos, right? Whatever happened in the past, what kind of a lifestyle that patient has, what was the last blood pressure, what was the last oxygen saturation, because during COVID, people now learned how to use a pulse oximeter. Those should all be ready. The facility should already be aware that that person has come. So registration should not take a long time like shown in Munnabai. And then that journey starts. The doctor also has a basic dashboard of scene. So that is what we call a practice management software, right? Then suppose the patient goes back home, then comes back that whoever sent it, maybe some person sent it to a specialty hospital. So it's a referral management software. Then it's about, you have so many, you go to an ICU, there are so many sounds here and there, alarms going on, no one is bothered. Why? Because most of them are noise. So you should develop an IntelliICU, which will take care of all these parameters and actually flag. In medical science, the most important process is triage. If you get 100 patients, you have to decide which 5 need the care the first. And then you ask any person who has been admitted in a hospital, what was the thing they hated the most? Other than the food sometimes, what they will say is that they told me I'll be discharged, but I was sitting the whole day. They said now it has gone to the TPA, now it has gone to the insurance, now the discharge summary is not ready. Once it is ready, I can go home. This all can be tackled by Zoho for Healthcare for a seamless journey. But the journey should capture all those individual things, even whatever drugs have been given, how the drugs have been dispensed, how it should be taken, and then when the patient goes home, then you can develop home care solutions, especially for the elderly. So, the sky, even I do not say the sky, maybe the universe or the galaxy is the limit. You have to look at real-time problems, talk to the people who are trying to solve it, and then together solve it. If it is done in such a manner, at least you'll get the blessings of 1.4 billion Indians. This much I can assure you.
Thank you so much, Doctor. So moving on to the next question. Over the next 5 years, where do you see private sector making the biggest impact, driving innovation and adoption within the digital health ecosystem?
Private sector should realize that science is the product and money is the byproduct, right? So in the next 5 years, so you'll have a ABDM marketplace, you'll have apps, but you have to ensure that people use it. People used COVID to take COVID vaccine. Why won't they use it? So don't try to blame always the user. If you do not make something which is user-friendly, if you make something which is user-friendly and they do not operate in silos, so wherever I am in Tenkasi, I go to Tirunelveli, I come to Chennai, then I go to Hyderabad. My continuity of care remains. My journey is captured. The first and the last person know what is happening to me. This can change the face of healthcare in India. It all depends on whether you have the knack of solving the problem and you fall in love with the problem. Please do not fall in love with the solution. You have developed something, now you want to fit it everywhere. No, why in 5 years, in 10 years, you will not be able to solve it? Fall in love with the problem, one step at a time. And I think private sector also has a duty, because you leave other things. Their workforce needs to be healthy. Why don't they take care of the health of their workforce using these digital tools? If everybody then takes up, say, one district, then the problem for India is solved. So I feel the way things are going and the way the government is also trying to develop ABDM, its marketplace, apps, interoperability, we should see a change where no one would be denied of basic care and at least the knowledge of what to do next.
Okay, Doctor. Doctor, my next question is on the ABHA line, basically the ABDM and everything. So how do you see ABHA, the way healthcare is delivered in India? So in simple terms, what benefits can patient get from having an UHID?
What benefit did the Indian citizen get by getting an Aadhaar ID? What benefit did they get when they developed their UPI ID? The same thing will happen in healthcare, right? So now it is so much easy. All people accepting money through UPI, you sending it through UPI. Now, in terms of healthcare, obviously, we are not saying that you will go to a medicine ATM and take it. But with an ABHA ID, with a point of care devices, with our ASHA workers, you can at least prevent 80% of the rural people thronging the corridors of the city's hospitals, which become overcrowded, and these people are also not comfortable there. So with your ABHA ID, with your entire journey, with teleconsultations, with basic diagnostic tests, basic medicine availability, I think it can go a long way in taking care. And one thing ABHA should also do is incentivize positive lifestyles. So if I am walking, say, 6,000 or 7,000 steps a day, maybe I'll get one extra leaf. That will make me healthier. And that also, the thinking has to be that we are trying to run the latest software on the human body, which has a 2,000-year-old hardware. You're not sleeping properly, always looking at the mobile screen. So those all things need to be taken care of. But how do you know what is working, what is not? That is where ABHA will play an important role.
Okay, doctor. Now, next question is on the same line from a doctor's perspective. So, how can ABHA improve patient care and continuity of treatment?
If a patient comes to me, has already consulted, say, other institutions, if I can now see what happened there, what they did, I will be in a better position to take a decision. And then, if I am also recording why I took a decision, what I have advised, the next doctor would be more wise. So it's all about wisdom flowing through digital means with the patient. It's not that the patient had some handwritten records, there was a flood and everything was destroyed. This makes the life horrible for the patient and for the doctor. So once this patient journey is smooth, then it would not be like a war, right? No one should be a warrior. It should be a smooth journey. You are building expressways, right? You are creating Vande Bharat. Now, why don't you create a similar health jatra which is smooth, which has less barriers? Obviously, there will be barriers there because of our sheer numbers and also lack of skilled people. So the same digital tools can also be used to upskill our entire healthcare workforce.
Doctor, talking about the future and the next decade, so I just wanted to know what trends do you think will define the next decade of the healthcare system in India?
The next decade will be for healthcare. Why? Because if you look at the finance sector, it has already been disrupted with fintech. You look at the education sector, it has already been disrupted. Healthcare has not been disrupted, and I use the word disruption in the positive sense of the term. It is high time that we try to leapfrog it, right? We know that it has crashed, and we also have to remember that we will not follow some of the most expensive disease care systems in the world. Those are not sustainable. India has its own set of challenges. We have to solve it in our own way, and we should not copy. You get a model from there and then you say, okay, now this will interpret Express for you. If you have to make India healthy and happy, then every person has to work towards it. Technology framework is already available there, but the technology should be customized for India, by Indians, and then only, I think 5 years down the line, if I'm alive, I can come and discuss what changes have come and then where we can go next.
So, and my next question is again on the next future generalistic things. So, how do you see AI and machine learning changing the diagnosis and treatment in India?
See, whatever my knowledge is at this point of time, the models are being refined and taught to do a brilliant job. The only concern is whether they work in India, right? So if you have developed something in Harvard and Stanford and then you use it, our entire thing is different, right from our skin color to our structure to our genes. So the tools are there, we can always use them, but the persons who would use them, AI will not generate a prescription and sign a prescription. AI will not sign a diagnostic report. Now, the person who will use it has to ensure that they are not using a black box. Some of the things which you are seeing right now, which are being promoted all over, they are black boxes. In healthcare, black box is the greatest danger, because if a mistake is there, you lose a single life or you cripple someone, that is not allowable. So we have to make it more transparent. Yes, it has to be revolutionary, but it should be responsible and transparent. And for it to become transparent, safe, the users should also understand what it is. I think we are taking certain initiatives. We have our own Academy of Artificial Intelligence in Medicine also, that you should be AI literate, right? You should be digital literate, so that when they come, you are not knocked out and then it seems that they are doing all the things and you have no control in delivering what you want to do. That is all. We have to do it.
And this is my last question. So, if you had a chance to give one piece of advice to the next generation of doctors, what would it be?
What I would say is that do not close your eyes. AI has already arrived. You have to play with it, try it, and I would request all doctors to take leadership of the team so that you can be a referee, you can modulate it, modify it, and use it so that your life improves in terms of productivity, the patient's life improves, and everybody is healthy and happy instead of it becoming a sad and mad world.
So, thank you so much, Doctor, for enlightening the conversation. It's been wonderful hearing your thoughts on digital health, innovation, and the future of patient care. So, we wish you very best as you continue leading change in the healthcare industry. Thank you so much. Namaste.